I'm Ed Jones, owner of Nutrition World here in Chattanooga, back with my partner, Dr. Christopher Green, and we've got a exciting guest this morning, Dr. Rowlett from CHI Memorial. He's Chief of Radiology. Welcome to Vital Health Radio, my friend.
Good morning. Thanks, guys.
We are kind of excited to hear and listen to you talk about a new imaging center CHI Memorial is opening, or has just recently opened, like in the past days. Tell us more about that, if you will.
Sure. So on Monday the 3rd, just this past week, CHI Memorial opened a outpatient imaging center there at the 4700 Battlefield Parkway Medical Office Complex right there on the first floor. And at that location, we're now offering most modalities, including regular routine x-rays, CT scans, MRI, ultrasound, and then we also have the MaryEllen Locher Breast Center located there as well, which offers both regular traditional 2D and as well as 3D tomosynthesis mammography, breast ultrasound, and we offer breast MRI and DEXA scan imaging for bone density.
Wow, that's great. And so you just got that open, and tell me exactly, if like I don't know exactly where you're talking about it is, tell us how someone like me would get there.
Sure. So if you're approaching on Battlefield Parkway from the interstate, it's just a mile or two down on the left-hand side in the large medical office building that is across the street from the newly opened Tennessee Oncology Center and the Center for Sports Medicine. And we're right there on the ground floor. So right when you go in the front door, we're right there on the left-hand side.
Well, I will tell you this. I'll speak for our group. We are so glad to have you there. Thank you for opening.
Well, thank you. Yes, we're excited to be there. It's been a long time coming. It's pretty sweet that we get to now be in the North Georgia community, in addition to having outpatient imaging at the imaging center in Ooltewah, and then also offering it in Hickson, and then, of course, downtown at the Glenwood
And let me
campus.
toot your horn a little bit. A lot of people, when they open up, have growing pains. So your place looks fantastic. I think you have extended hours. I walked down there last night, 2 nights ago, and took a look, and everybody was so nice to me. And I have not heard one glitch with anyone scheduling anything at all this entire week, and that's incredible. We've gotten everything back so fast. So we're going to be spoiled real quick, so keep it up. Thanks.
I'm glad to hear it. Yes, we are open 12 hours a day, Monday through Friday, from 7 a to 7 p. And then on weekends, we have a morning window where you can come in and get imaged as well from 8 in the morning to 11 to try to overlap some with actually y'all's office up there, upstairs. And, we've been fortunate that we've been able to hit the ground running this week, and we're looking forward to expanding, our services a little bit. We've got some room to grow potentially, and then we are looking forward to working, especially with our the CHI Memorial Breast Care Associates. There's 3 young female surgeons, Betsy Washburn, Nicole Walker, and Tequila Williams, that are sort of the core backbone of breast surgery at CHI Memorial, and they're rotating through that office building in that space. So we're able to work more directly with them in that location as well.
Yeah, that's fantastic, and we're so excited about that. And Ed, I think we had Dr. Williams on our show a while back, a month ago, perhaps? So
I believe you're right.
Yeah, so we're excited about that as well. All of our patients are. So the more we spread the news, the more patients we're going to get. But that's fantastic. I'm still hoping. We were talking on the first segment about the fact that we still hope CHI is going to build that 60-bed hospital in the parking lot. So we'll see. But, it got put on hold indefinitely with coronavirus. So hopefully that will come back sometime soon, and that will be fantastic for the North Georgia community as well.
Yeah, you're right. It is. I saw some of the renderings pre-COVID, late last 2019, and that looks like a great option for that area, and really right on the end of that building. So we are hopeful as well that will ultimately come to fruition. Our imaging center will hopefully be able to just sort of blend into the hospital setting. We'll have to figure out exactly how to handle in versus outpatients, but it's a great start for us in that physical space, and we look forward to hopefully being able to open up a hospital there as well.
Well, on a bit of a tangent, I was able to walk down there. Anybody in the building can and just take a quick look. But I was hearing something about a virtual tour with maybe even some prizes you guys are setting up. What's up with that?
Yeah, so due to the COVID-19 pandemic, we couldn't really do a typical grand opening of a new facility like we had hoped. So CHI Memorial marketing folks have put together a virtual tour. And so anyone is welcome to jump online at memorial.org/parkway, and you can take a virtual tour of the new facility anytime during the month of August, starting now. And at the completion of that tour, you'll have a chance online to register to win some Apple products, I believe, and/or gift cards.
Fantastic.
Well, I've been operating Nutrition World for 42 years, this January, and I certainly hear a little bit different, maybe communication from the public because I am in a different field totally. But so many people who come and speak to me and ask me questions don't have insurance. What does a person do who may want to desire some of your services? How does that work?
Yeah, it's a great question. The center is certainly open to anyone. You don't have to already have a physician in the CHI Memorial system to come and have your imaging done. But I would probably encourage those that are un- or underinsured to first work with whoever may be ordering their imaging exam to see if they have any pathways through the referring physician office. And then the next step is probably to reach out directly to the imaging center itself and to talk to them about what may be available in terms of financial assistance. CHI is a pretty large organization. They've got a lot of outlets and avenues for trying to work with folks that are either underinsured or completely uninsured.
Well, that's interesting. So tell us about how people could contact you or that number or the website so that they can have more information, please.
Sure. So the main imaging center is at 4700 Battlefield Parkway there in Ringgold. And if you're looking to have an imaging study done, the main phone number to the center is it's area code at 423-495-7678. And more specifically, if you're looking to have some breast imaging scheduled, either mammogram or diagnostic mammogram and ultrasound, to schedule a mammogram, you would call 495-4040. And also where you are, again, available online on the internet at memorial.org/parkway.
Well, that's awesome information, and it's exciting to hear about it. Despite all the craziness of the world, you got everything open, and it sounds like, at least especially from Dr. Green's standpoint, it's running with all cylinders.
Yeah, I think so. I was there for the first 3 days this week. We had a good number of patients coming through from all sorts of referring providers, not just in that office building, but throughout the North Georgia community.
Nice.
And we look forward to building those relationships with those referring physicians.
Well, it sounds like you got all of Chattanooga covered now, don't you? All 4 sections.
We hope so. We're always looking and strategizing about where may be the next best place to go to reach out to.
Well, I have to give whoever is in charge credit, because I am a lifelong entrepreneur businessman, and the fact that you're willing to be open 12 hours and give at least a half a day on a weekend says that someone is forward thinking, because these businesses who think we should bend around their schedules are foolish to me, and especially during these kind of times, it's time to reach out to people, not have them reach out to you. And I give Memorial a lot of credit for being able to be flexible and helpful to people who have busy lives and busy schedules. So thank you very much for that, Doctor, and thanks for all the information. It'll be valuable to the right people at the right time.
I have a question. I probably wasn't paying close enough attention, so let me ask again. It may be of interest to other people as well. Did I hear you say Saturday hours?
Yes,
we
will be open Saturday, 8 to 11 a.m.
That is so fantastic. I mean, we're not used to that. And those are certainly, from a primary care standpoint, those are not the usual radiologist hours and days that I'm accustomed to. So,
Sure.
Yeah, that's fantastic.
Well, thank you, my friend, and hopefully if you're ever by Lee Highway, come in Nutrition World and ask for me. I'd love to meet you, okay?
All right. Thank you, guys.
Thank you.
You know, if anybody's there getting imaging and does need a primary care doctor, really anybody else, CHI, this building is full of CHI employees. So there's plenty of choice. Just they can run upstairs and find a doctor. Come on.
Come on. All right. And then when they get ready for some nutrition, they can go find Nutrition World on Lee Highway. Right?
Yeah, I almost feel like we need to start a little bit of an outlet down there, Ed. What do you think?
I'm too old and too tired, brother.
All right.
I got 6 days a week where I am is all I can handle. I do want to talk next segment about school openings. I have really kind of studied that a lot. I know that last week the CDC director was being interviewed by Good Morning America, and she was speechless because he said, I will be more than happy to send my 11 grandchildren back to school because the risk is low and staying home is not a good thing. And I love that because she did not expect that answer. I also have posted several things, so studies from CDC and other reputable or recognizable agencies that are also in agreement with that.
Well, I will say this last week, even though we're following all the precautions that we have to do, I would say it easily 85% of the patients were completely free of fear. They just weren't worried about it. They're
Really?
taking the precautions, but you could tell they've started to realize what is real information, what is disinformation, and how to be safe, and they're just living their lives and doing that. And by the way, I did notice down in your radiology center that they even had the either glass or plexiglass shields. It's made. I haven't seen many places that are new construction made for coronavirus, but this one was already
Really?
prepared for that. Right? It was well done.
Well, and that's nothing wrong with that because it helps everything with everything.
But most look just like they rigged it at the last minute. And
Yes,
this looks neat. So I have to give you kudos for that too. I forgot to say that. It looked nice, not just a second thought.
Not rigged.
Yes.
Yeah, like rigged, like Nutrition World. I hate to even think of how we looked.
I was not pointing my fingers at you, Ed.
That old cheap plastic from Ace Hardware. I love Ace Hardware, but I couldn't do any better than that. We've actually taken that down. We do practice all the right procedures. We all wear masks and all the right things, but that plastic came down except on one register because we know we want to respect people, and I'm fully in agreement that those who know they are at risk should step up to a higher level of protection. But it's their responsibility generally, not totally, but generally to do that. Stay home if you're really immune compromised or you're already, know that you'll die if you get any infection, not just this one. Again, boost your immune system with vitamin D and the right things, but, practice safe practices every single day. That doesn't apply to people like you and I as much. It just doesn't. Or kids who go back to school.
True.
And fear-mongering and hysteria is at a fever pitch, people. Fever pitch, and you cannot believe most of it. A little you might, but it's all been bent sideways, just like the article on WTVC TV that about all the people who've been exposed or possibly exposed. It was so vague, but yet the headline was not vague. The headline is what would shock somebody. In fact, a school teacher came to me and said, how dare schools open 250 reported testing positive. No, she didn't read the next 8 words, or possibly exposed. No. And I'm going to have to stop here in a second because I'm getting on a rant here. But the vitamin D, we know for a fact that if you have 30 nanogram or less vitamin D when you get COVID, you have about a 90% chance of severe symptoms. When you have a vitamin D of over 40 nanograms when you get COVID, you have about a 92% of modest to less than modest symptoms.
Actually, I'm pushing for 50.
And 50 is what I want people to have. So I went on social media. We're giving teachers free vitamin D along with healthcare workers from Nutrition World with proper ID. We've only given away 2 teachers, and we've given away a bunch of healthcare workers. However, we did just start the teacher thing, and they are getting ready for school. But I'm hoping that they will start piling in.
And you know what? The schools, people understand. I think people are well educated now, so they can go to get their radiology. They can see their doctor, go to Nutrition World, go out to eat. And this is a relatively safe environment. I keep thinking, would we have done this at the start of flu season this year and say, we just have to shut everything down? No. But we're going to be much better prepared. I can't wait to see what a light flu season we have.
Yeah, and it should be. And cold season. It won't affect allergies much probably, but everything else it should. Well, it's time to take a break. When we come back, we're going to be talking a little bit more about the school openings and some about other health topics like I want to talk a little about vitamin K, a podcast that I did. I want to share something about this huge decal that I put on one of my employees' cars that I'm going to show you in a minute, Dr. Green. So we've got that plus more to come. For Dr. Green, I'm Ed Jones with Nutrition World, and stay with us.
You've been listening to a special edition of Vital Health Radio presented by CHI Memorial on 98.1 The Lake, a production of the Whitfield Media Group. Visit our website at vitalhealthradio.com, built by Avalon Design Studio. I am Sean Whitfield, and thank you for listening.